Welcome to the Dental Brief, the world's direct, right-to-the-point podcast produced to get you the information you need to learn and grow your practice. To learn more about our guests and find links to information discussed on our show, visit our website, dentalbrief.com. On to today's episode.
Hello, everyone. Welcome to another episode of the Dental Brief. I have with me a fellow Coloradan, Dr. Matt Allen. Dr. Allen, say hello.
Hi, nice to be with you guys. Thanks for having me.
Hey, I love having dentists on the show who still practice and turn entrepreneurs. I'm really grateful to have you here. I think our audience always likes it when a fellow dentist or someone who's actually been in their chair, if you will, is on the show. Why don't you tell us a little bit about how you got into dentistry and then how you got into your area of expertise now?
Yeah, it's a fun story, maybe. I think as I've been listening to several of your episodes, kind of preparing for this, and it sounds like a lot of people have dads who are dentists, and I did as well. So kind of was exposed to it. Never thought that I would actually do it. I almost dropped out of college to pursue a career in music. Thought I was going to be a rock star. That didn't quite turn out the way I hoped, which was fine. But yeah, so I have been working in community health in Colorado for a number of years. Really wanted to make a difference and was working at a great FQHC in Denver. And through that, through a mentor of mine there, highly integrated. So one of my mentors was a medical director. And he kind of introduced me to this idea of what's called motivational interviewing. Essentially, how do we talk with people to help them make good choices? I think oftentimes in dentistry, that's often you should do this, right? And that would be great if that worked, but unfortunately it doesn't. And so this kind of style of communication that comes from originally addiction therapy and has kind of come into medicine, really was speaking to me and kind of inspired me. And I said, where is this in dentistry? I couldn't find anywhere. So I said, great, I will help bring it to dentistry. And so that's what I've been doing for the last 5 years, really just kind of living it. I joke sometimes that I've spent the last 5 years trying to forget that I'm a dentist, that I can really understand the patient perspective and what will work in terms of that, and what do patients really need from us as dentists.
Yeah, I've thought several times that it would be great at some point to have 10 or 12, 14, 15 consumers come on the show. And let's ask some questions, right? That kind of feedback would be interesting, I think, to hear those kind of candid responses that a lot of consumers would good. So let's talk about motivational interviewing, right? So let's talk about, you mentioned kind of the definition of a little bit, but what does that look like to a dentist? What should they be doing? What should they be talking about with patients?
Yeah, I think it's so important, and something that I think is becoming more known in education. Certainly when I talk to younger dental graduates, they're certainly seeing it, especially a lot of hygiene graduates. I think it's something for the entire office, certainly not just the dentist, but really kind of goes back to the idea that if traditional patient education worked, right? So brush your teeth twice a day, floss, right, blah, 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 whatever we might tell patients, we would see a lot less cavities right now, right? Like we wouldn't have these issues. So really, kind of comes back to our understanding that this is a really behaviorally motivated disease, especially with caries and periodontal disease. And so what patients are doing at home in the thousands and thousands of hours that they're outside of our dental clinic every year really makes a difference. So is there a different way that we can talk to them when we're in our office that might help them, empower them to choose those behaviors that are healthy instead of just kind of telling them what to do? I think often we think education or some sort of knowledge is the most important part of behavior change. And it's foundational, obviously. People need to have some knowledge generally, but then there's this kind of next level of motivation and having the right things, et cetera. So that's really what I think we can focus on more as dental professionals is, why might you want to do this? How would you? Finding patients' own reasons for wanting to make change is much more powerful in terms of actually helping them do that.
Sure. What do you think about that? Interviewing patients more before diagnosis even happens, in the sense that, or before they're ready for a diagnosis. So the first time a patient comes in, what should that look like? I know, and I tell dentists all the time, like, you need to keep time open on your book every single day for new patients, because if you can't get them in, they're going somewhere else. And I think that's really important. But if they're last minute, if they're coming in because they're in pain, that probably also means that we're kind of skipping steps, right? And not really interviewing them to find out what motivates them. And really the motivation, I have to assume, and you're the expert in this, not me, but in my experience, is pain and pleasure, right? Those are the two biggest motivators anyone has, or at least that I know. And maybe in your techniques, you see some different things. I want you to share that. But if we can understand what causes them pain and what causes them pleasure, we can really help them navigate how their treatment plans are going to go. Correct?
Yeah, I think that that's a very good framework, right? Like in terms of, I don't ever start an appointment without asking a patient, whether that's a new patient, whether that's a emergency patient potentially, what's important to you, what matters most to you. Especially if it's a new patient, I'm always going to ask, what are your goals for your teeth, for your oral health, right? And now that's allowing them to kind of set that North Star. So I want to keep my teeth healthy. I want to be able to eat till I'm 80. I want my teeth to look a certain way. I don't want to be in pain. I want to be able to smile at my job, whatever that might be, right? Now they're the ones who are saying that. And we can start to say, that's a really great overarching goal. Let's talk specifically about some of the things that might, you might need to do to get there, right? There might be some things that we need to do here in the office, whitening your teeth or, whatever, that placing sealants if they just want to prevent cavities, whatever it is. But ultimately, a lot of that is going to happen at home. So let's talk about specifically what you think you can do at home and why you might want to do it and how you can do it, et cetera.
Sure. So let's talk about steps. What are some things, what are some steps that dentists can take today, or anyone on the team for that matter, to actually get better at communicating, to start to incorporate MI into their daily habits and how they communicate with patients?
Yeah, this is a really, I've spent the last 5 years thinking about this. What can we do? What are specific pieces that we do all the time? So here are a couple of things that I kind of generally encourage people to do is, number one, ask engaging questions, which are generally open-ended. Not telling people what to do, especially, but like when we're asking them those questions, make it so that they can answer in a way that allows them to kind of envision what that will look like. Especially for the rest of your staff in your office, what I call setting the table. So here's my name, here's my role, here's my time, here's my agenda, and like ask permission. So, hi, I'm Dr. Matt. We've got about 5 minutes today to chat and kind of think about what your goals might be before we review your x-rays. Does that sound okay with you? So that people know who they're talking to, if it's the dental assistant or whoever, everyone can do that. That's helpful in terms of engaging patients. And then we often share information with patients, and that's super important, but to do that with a framework that encourages patient feedback. So in motivational interviewing, the framework is called elicit, provide, elicit. To me, that sounds jargony. I like explore, offer, explore. So sure. Find out what the patient knows. So if you're going to talk to them about dentures or crown or whitening or sealants, whatever, what do you know about this? Share some information. It's got to be brief, not filled with jargon, not the time to stand on the soapbox, right? But then most importantly, perhaps, is to re-invite the patient back into the conversation. What do you think about that? What does that mean to you? What questions do you have about that? Now you're starting to have this conversation where sharing information doesn't become a monologue, it becomes a dialogue. And that's really where we start to see patients take that information and make it actionable.
That makes sense. Following that up, what are some things that you see dentists do a lot and things that they say? If we had a jar in a room that had to put $5 in it every time they said something, what's going to fill that jar up? What words are going to fill that jar up the fastest?
Ooh, yeah. I think so many people have really good intentions in this, right? So I don't think it's something that we're trying to do, intentionally to make patients feel bad or whatever. But I think what I see most is just a lot of dentists assuming values for patients. Well, I'm sure you want to be able to eat too, right? Or I'm sure you want your teeth to look a certain way if a patient hasn't said that.
Right.
And then, so that's number one. And then number two would be essentially giving patients answers. So if a patient says, well, I want healthier teeth, let's say a teenager said that, well, I want healthier teeth, I just forget to brush my teeth at night. Oh, well, you should really set a reminder on your phone because that will help you, right? So it's like we're trying to solve the problem because generally dentists are fixers.
Right.
Instead of saying, oh, cool, what ideas do you have? And 99 times out of 100, when I talk with a teenager, they're going to, find a way to make their phone help them remember to do that thing. But we want them to say it. We don't want to offer that as the, at least as the first option.
Right.
We want to try to give them the opportunity to find that solution for themselves. It's a much more empowering way of communicating in general, not just with patients, but with your kids or, whoever.
Right. That makes a lot of sense. I have teenagers, and you definitely, my first recommendation is don't recommend anything to teenagers you actually want them to do. Just, tell you, take the toothbrush away, hide it somewhere, let them find it, and then they'll start brushing their teeth. I think that's the way to go.
There you go. Right. I think that's a pretty true, it's a psychological truth that people want to find their own answers and generally are more successful at implementing what they, think of when it's their idea.
It makes a lot of sense. So let's talk about, let me first of all tell my audience your website, your URL. It's mdavid.com. So M, then the word David, or the name David, I should say, and then mi.com. I want to encourage our audience to go there. And then real quickly, a couple minutes or less, tell me how you work with dentists across the country and kind of what that relationship looks like if someone wanted you to help with implement better communication into their practice.
Yeah. So, over the last 5 years, I've really been training dental professionals in this, whether that's, usually before pre-COVID times, I would host a 2-day workshop in person in Denver. I would, be part of national teaching collaboratives, et cetera, to help dentists do this better. But have worked with private practice offices to help them as well. And obviously during COVID, that, can happen via, digital formats, which is really nice for people in terms of not having to travel. Right. And just allowing us a lot more touch points. So yeah, I mean, if you're interested in this, I really do think that there's a huge benefit to patient satisfaction, to office satisfaction, et cetera. And our new kind of way that we're thinking about this is taking it directly to consumers, to kind of help empower them that if your dentist might not be asking the right questions, you still can. And how do you do that? And how do we help empower you? So that's kind of the new digital health startup that I founded to kind of speak directly to consumers to work on that piece of the puzzle.
Yeah, I want to have you come back on the show and talk about that. But it does bring up a point is that consumers, as much as we don't like it, as much as we want to fight it, consumers do drive trends in medical and dental. There's no doubt about it. And it's going to continue down that path for quite a bit. So some of these things we just absolutely have to embrace, the way the behavior is changing. And I know some people will resist until they can't afford to resist anymore. Dr. Allen, I want to thank you very much for coming on the show, Matt Allen. Check out the website, everyone, mdavid.com. Thank you so much, sir.
Yeah, thanks for having me. Have a great day.
Thank you for joining us on today's episode. Did you know you can weigh in on today's topic on Facebook? Search The Dental Brief on Facebook or visit our website, dentalbrief.com, and just follow the link. We look forward to having you join us again on another episode of The Dental Brief.